was doing a drill. She came down, landed on someone's foot, and went ahead and, with her foot pointed and the sole of her foot going inward, she says she rolled her ankle. Okay. So when we go to test this anterior talofibular ligament, you have the athlete sitting. You're going to be facing them. Okay. And one of the best ways is you actually have the person come towards the edge of the table so that their knee is bent. So keep going and bend their knee. There's many different ways. Sometimes you can go with the legs straight. Some of our team physicians recommend that this is probably one of the better ways to test this anterior talofibular ligament. So if you can't see, you may want to kind of get to where you can. But when you look at, I'm going to have Carrie kind of scoot her leg over this way so you guys can kind of see. So basically with her leg hanging over the edge of the table, nice and relaxed, I'm going to go ahead with one hand is going to grasp the lower leg because we want to provide support. And then the reason why they call it drawer is that the action that you're going to pull on the ankle joint is like pulling out the drawer in a cabinet. So hence the term anterior drawer. So hand here, your other hand you're going to cup the heel, okay? Or called a calcaneus. We're going to cup that, and the foot is going to rest on my forearm. Okay? So I'm going to go ahead and kind of stabilize your foot. And then what I'm going to do is go ahead and relax. And then what I'm going to do is I'm going to pull in this manner. I'm going to try to pull her ankle forward and the foot forward. Now, if there's a positive sign that there's a ligament tear, you'll actually feel the foot as well as the ankle. You'll feel a clunk. You'll go boom, and you'll actually feel where the tibia and the fibula meet. You'll see the talus actually ride forward. So it's almost like taking the statue here, okay, our skeleton. We brought him up here. Actually taking the individual's foot, going like this, and pulling the whole entire foot forward because the ligaments aren't holding the bones together. Okay, so that's in essence what we're doing. Okay? So that's anterior drawer. Bump test. Possible fracture. Okay, so what we'll do is we can actually keep them in the same position. You're going to just take the heel of your hand and just gently bump the heel, the bottom of the heel. And basically what we're doing is trying to send a shock wave through the foot, through the ankle joint, into the lower leg, and see if you reproduce any symptoms. Now the symptoms will be very sharp, very pinpoint, and very localized pain. Sometimes people will describe like it's an electric or a shocking type of sensation. That's usually what happens if there's a fracture because the bone, there's a kind of a break in the continuity and the nerve endings will do this. With the vibration, that's where you get the reproducing of symptoms. All right, so that's the bump test. The squeeze test, the same thing. But you're going to take both hands and starting from the area where they complain of the most pain and starting away from that and working towards it, you're going to squeeze the lower leg. And basically what you're trying to do is squeeze the tibia and the fibula together to see if you kind of reproduce any symptoms. So you go ahead and squeeze. You might ask, do you feel anything there? Any pain? Work your way down. They may say yes or no. If they do say yes and they're very specific, you're stopping all things right there and going and starting to immobilize and just suspect they have a fracture. So at any point during the assessment, you think that this individual's got a fracture of some sort, like a break, you want to stop what you're doing and go ahead and start to splint and immobilize it. We'll talk a little bit about that later in the semester. But so through the evaluation process, anytime you see deformity, you get pain with these special tests, and you think there's a fracture, you're stopped and you're going to go ahead and start immobilizing, get them to the doctor. Okay? All right, so bump test would be here, squeeze test, you'd be squeezing both bones together. Talar tilt, I'm going to have you scoot back a little bit. Talar tilt, we want to kind of take a look at the ligament structures on the inside as well as the outside and the inside of the ankle. The outside, the lateral structures that we talked about last week, you have the anterior and posterior talofibular ligament, and then you also have a calcaneofibular ligament. The medial side or the inside of her ankle, they have the deltoid. So what we're going to do is we're actually going to take the talus. You're going to kind of have the person sitting so the leg is straight. You kind of make a C with your hand. And what you do is you're going to go right on kind of the midfoot and a little bit in front of the heel. And you can see where my fingers are at. You guys can kind of see my finger placement. I'm really trying to find and palpate the talus. So I'm really trying to get my fingertips on the talus. And then what I'm going to do is I'm going to move her foot into inversion. And I'm pulling here to see if there's any stability. If the ligaments are sprained or torn, as I do this, you will actually feel the bone go out. A little clunk, a little clunk. And you'll feel it kind of slipping out of that joint. So if you look at the tibia and the fibula, it kind of creates kind of like a groove, and then the talus or the ankle bone sits up in here. So what I'm doing is trying to make it slip out one way or the other. So if I go inversion, okay, if I move the foot into inversion, I'm testing lateral structure. If I'm going into eversion, I'm testing the medial structure. So you may want to write that down. If I go and the talar tilt, if I'm moving it into inversion, I'm testing everything on the lateral side. Anterior talofibular ligament, posterior talofibular ligament, calcaneofibular ligament. If I move it into eversion, that sole of the foot moving outward, then I'm testing the deltoid. Okay? All right, Cligers. Cligers is for that syndesmotic ankle sprain. What you're going to do is you're going to actually put the athlete and move into what we call dorsiflexion. Many times if they have a high ankle sprain, just the simple act of putting them into dorsiflexion will be painful. So if you can imagine here, let's say we'll look at our skeleton, and we look at down here where the tibia and the fibula connect, there's a ligament here. So if you can imagine that ligament is stretched or torn, so if I move the foot into dorsiflexion, that force is going to spread those bones apart. That's why high ankle sprains are always pesky, because every time that you bear weight, it's going to spread apart. And it can cause a lot of pain and instability. So a lot of times, just by putting him into dorsiflexion, it causes pain right above the joint line. Many times you would figure there could be a possibility of a high ankle sprain. But in order to do Cligers, you got to go up and then externally rotate the foot. So you're really trying to spread apart those ends of the tibia and the fibula. So have them relax. You're going to passively put them into dorsiflexion and then externally rotate their foot and see if you reproduce symptoms. The last one, Thompson's test, I'm going to actually have you lay on your stomach here, but your head is going to be at that end because I want this foot towards your audience. So say Carrie's, she's running around and she went to stop and she felt a pop in the back of her heel. And so we're going ahead and doing our assessment, and she's telling Bill, it felt like somebody shot me. Okay, a lot of times that's that cardinal type of symptom and type of sensation when you kind of blow your Achilles tendon. So basically what you're going to do, and watch your foot, see if it works. It should. You're going to take the calf, and as I squeeze, what happens to her foot? It moves. Okay? So as I squeeze the belly of the muscle, it's going to pull on the tendon, and you should get some type of movement. Now, if they have a rupture of the Achilles tendon, you're obviously going to see a lot of swelling right in that Achilles tendon region. But as I squeeze, there's going to be zero movement out of the foot. Okay, so that's usually a positive sign. So laying the person face down, you want to grasp the belly of the calf, squeeze gently. You're watching to see if the foot kind of moves into plantar flexion, like the toes move, the ankles move. And if it does, that's a negative sign. If it's positive, you'll see swelling around the back of the heel, and there'll be no movement when you squeeze the calf. And so that will be an indication that they have a torn Achilles tendon. Okay, any questions with that? All right, so go ahead and partner up. Get about groups of 2 or 3.